Hello again, everyone. Mark Hack, Macomb County Executive. John Paul Rea, just Deputy Executive here in the county, giving you the update of what's going on here Monday. Before we do, though, I want to remind everybody, tomorrow is primary election day. So make sure you kind of voice your concern of representation, who you want to vote for. So whether it's an opportunity to go ahead and get an absentee ballot, which you still have time to do, or show up at the polls, which is going to be a little bit different. Make sure that you are wearing a mask, because I'm sure they're going to be doing social distancing and following CDC guidelines at the polls. So, but again, please remember to vote. On that note, John Paul, what are we looking at as far as numbers? We've kind of closed out July, and now we're moving into August as far as some of the, I guess, if you will, categories that we put up there. We like to let people know month by month how things are playing out.
Mark, as we do when we close out every single month, we'll be doing some housekeeping over the next couple days as we close out cases with the state DHHS. One of the interesting things is, as we sit here today, number of cases in July is about 1,800 cases. The interesting number is the number of deaths only hit 11 in the entire month of July. Again, as we've said time and time again, each time we lose a resident of the county, we're very much mindful of it. I think the other thing that is very interesting too, as we look at these trends, again, the recoveries continue to mount. We're over 6,300 individuals that have recovered from this case, and again, keeping that 7-day average on that death rate about 0.3. So we'll be working with the state, updating it, then cataloging everything that's starting here up in August. But a tremendous amount of effort from our health department, working with our regional and state health advocates and experts.
And I'm hearing that there's a bit of backlog, if you will, the number of tests that we're doing with actually getting the test results back. I got a friend of mine that actually said he had to go to the hospital for a different reason. They gave him the test, he says, and he's been still waiting for a result on this thing, and it's already been 12 days, and he still hasn't got a result back. I'm thinking by the time you get your result back, you'll have already gone through that 14-day quarantine period. So, interesting enough, it is a challenge.
Yeah.
I'm hearing that they're really having a hard time with backlog, and even some of the recording of the data that we're getting, because even our August numbers aren't in yet. We know we went through the weekend, but the state is having some challenges with providing that data.
Mark, the update this morning that we got from the health department is some of the labs that are working on the caseload for the state of Michigan have a backlog of about 14 days in responding to those positive tests. That is going to take a lot of numbers over the next 2 weeks and make it quite volatile as far as reporting what's on our dashboard and ultimately what the state classifies and certifies too. That's going to be the big part of that housekeeping over the next 2 days as we not only close out the July numbers, but as we look to August and ensuring that we have all of the necessary support we need from the state to do everything from our contact tracing to working with resource allocation on the healthcare side and ensuring that we're continually responding and monitoring to this.
Yeah, and on that note, I mean, obviously it leads into the conversation as to where we're headed as a state. Still don't know, if there's going to be that step back, pulling back, or even the concerns dealing with schools, where we're headed with the schools. We know that some of them are already starting their athletic programs, trying to social distancing, doing a lot of the stuff outdoors. I go to many of the schools that have run the track, Henry Ford, Dakota, and it's interesting when I see some of the kids out there, they are practicing social distancing. I'm noticing that they're actually taking their temperatures as they're coming in to kind of congregate to get ready to start, whether it's the softball, whether it's the football, even the band members out in the fields, they're keeping that distance, which is a good thing to see, but there are some problems they're running into where some of the kids are testing positive. They have to shut them down for a while, but everybody's still anxious to want to get up and running, whether it's the sports programs or, more importantly, the academic part of this. And we're still not really knowing exactly the direction the state is going to go in, but rest assured, here in the county, we are working closely with our school districts, in particular ISD, to make sure what they do, we're going to be able to help them, whether it's the technical aspect with computers, technology, and or PPE if they are going to be in the classroom.
Mark, I think the key thing is to not only have an adaptive strategy, but as we've said, with the federal resources that we have with the CARES Act funds, we're going to make sure that they have the most resounding and beneficial community impact. So as we continue to not only analyze the intel that we're getting from the MISD, working with the state of Michigan, understanding where the governor's office may go with, as you said, whether it's phasing elements back, whether it's looking at restrictions or limitations, those are things that we continue to monitor from our emergency operations center here at the county.
And if you're a business, again, we're here to support you. Go to macombgov.org. We got still PPE opportunities available for you if you're looking for that. Startup kits, recommendations, how to guide yourself through some of the executive orders. We're willing to do that. We want to work with you, even if it's on an individual basis. Please get a hold of our planning department. Do it through macombgov.org. You can make that connectivity, and even some of the funding that we've been able to make available to you through the CARES Fund. So we had our first couple of rounds through that. Businesses have benefited, but there's still businesses that can benefit, even those that are home-based businesses, as well as some of these nonprofit
Correct.
organizations. So if you know of people that are out there looking for a little bit of support, want some help, please guide them to macombgov.org. So
I think the important notification on that end is this Wednesday, August the 5th, both the 50 plus to 500 employee grant program closed out for the county level, and then also the MEDC Restart program through the state of Michigan. So again, as Mark highlighted, all the details available through macombgov.org, and if you have any questions, you'll be able to get connected with someone in our planning department.
yeah, so that's our update for today. We want to remind you once again, tomorrow's election day, so get out there and vote in our primary elections. And most importantly, we want to continue to remind you to keep you and your family safe.